how are the strikes affecting transport and hospitals? Paul Davies is at Heathrow Airport. Marc Mallet is in Belfast, where the public transport network has been shut down. And Annabel Roberts is at a hospital in North London. To Paul first at Heathrow, fair to say, Paul, that the disruption is not as bad as expected and predicted?
Well, all that talk of gridlocked Heathrow, delays, cancellations, diversions has proved to be just that, talk. The reality, with Home Office staff and police officers manning passport controls, has been a pleasant surprise for most passengers. In fact, many are saying they've been passing through the terminals quicker than is normally the case. I think that strategy employed by the British Airports Authority, painting the very bleakest picture last week, has worked in that it's persuaded many thousands of passengers to change their travel plans. We're hearing 20 to 25% fewer people passing through Heathrow today. There have been some special measures there. There's food and water, airside in case there are queues. There's marquees outside the terminals in case there are cancellations. They've not been needed. Perhaps summing the whole thing up, one passenger arriving from Moscow who told me he's always going to travel on strike days from now on. He says it's been a quicker, quieter, altogether better experience.
Well, the public transport system here in Northern Ireland has ground to a complete halt today. Bus and rail workers decided last week that they too would be heading out on strike, meaning that the government-funded Translink, the body responsible for delivering bus and rail services in Northern Ireland, had no other option but to close down today. Again, there was much talk about there being a massive impact on services today. 250,000 people use bus and rail services in Northern Ireland on a daily basis, but that hasn't really materialised. The traffic has been moving quite freely, and presumably that's because many non-urgent medical appointments were cancelled as a result of the strike action, and many schools were forced to close. Two-thirds of them, almost 800 schools right across Northern Ireland. There have been hundreds of picket lines set up and demonstrations taking place in towns and cities right across Northern Ireland, the biggest here in Belfast. And police say they will not be enforcing the bus lane system this afternoon in a hope to fend off any further disruption in the afternoon rush hour.
Here at the Whittington Hospital in London, only emergency services and cancer treatment are going ahead. There's a picket line behind me of about 40 people, as you can hear, getting plenty of support from drivers going past. Across the country, about 400,000 NHS staff, from cleaners to nurses, it's estimated, have joined this strike. And because of this, about 60,000 appointments and non-urgent operations have been cancelled. But emergency services and maternity services are going ahead. But of course, key to those going ahead is the ambulance service. And the picture there varies across the country. In Manchester, 50% of ambulance staff are supporting the action, and I've spoken to staff there. They say they are answering about that 50% are supporting it, so they're getting through to most people, but there are delays in ambulances reaching those patients. So the picture varies across the country, but essentially emergency services with delays.